Vanwege de vele geboortes bij het Slaans Hospitaal is het meer dan verantwoord dat het Slaans Hospitaal nu voor hun neonatale zorg toch wel high care aanbiedt. Want als er iets is, moet men hiervoor dan uitwijken naar het Academisch Ziekenhuis Paramaribo. Nou, met een donatie, met tussenkomst van Shell Suriname, is dat nu mogelijk, want zij hebben dan wat geavanceerde apparatuur gehad voor hun neonatale zorg. Het ziekenhuis die is zelf bezig een afdeling op te zetten waar binnenkort dan high care neonatale zorg aangeboden zal worden. TBN, PRIMEALERT, die was er aanwezig bij de donatie en voorafgaand aan de overhandiging van het apparatuur zijn er dan ook verschillende speeches geweest.
You are a part of a big puzzle. And we started to put together the puzzle in 2020 with the idea of a wish, a long existing wish of a neonatal high care unit for our babies who are born with complications preterm and who need some special care the first weeks of life. So that puzzle consists of various parts, and one part is all parts are important, but without medical equipment you cannot take care of these babies. So you are now today part of putting together every medical equipment that is needed for the department, and other parts are the technical electrification, generator, and the last part is the building where the ward will be installed. When we asked this donation to Shell, we didn't have the financial means for the building and the other parts of the ward, but then came Minister of Health, and with the good news that the Ministry of Health through the Ministry of Finance will help us with the financial means for setting up and building the ward. So that was a big step forward. In the meantime, we were gathering all the needed equipment, and we got the approval for the equipment that we are being handed over now with the help of Staatsolie, also welcome. And so today we will get one baby incubator, and this is called a NeoPuff equipment, and I will give some explanation. The one incubator is part of four incubators we need for the department. So 1/4 is given to us today, and also the NeoPuff equipment is part of 4. Every baby bed needs such equipment. So this is one of the 4. So the part of Shell is very, very important. Without these donations, we are not able to level up our care, the quality of care, because that is what we are working on, to provide our newborn babies with the care they need. The thing is that mostly the babies, when they have problem with breathing or lung problems or prematurity, we have to transport them to the NICU of the academic hospital. NICU stands for Neonatal Intensive Care. Intensive care means you have to make the baby breathe through equipment that goes into the lungs. On the high care unit, we will help the baby breathe from the outside. Therefore, we also have special equipment that is called CPAP. So you have the medium level care, and Sister Harp is here. She's deputy head nurse of our medium care ward. Then you have the next step, that is the high care. And the last step is the intensive care, which is situated in the academic hospital. So our ward will help the total neonatal care in Suriname to provide the care to the newborns with problems.
Staatsoli is a partner of Shell in the offshore blocks, so all requests have to be channeled through Staatsoli. That's why we named Staatsoli and welcome Staatsoli also here. And for this purpose the purpose is to improve the medical care of neonates in Slans Hospital, as you heard. Based on the good relationship and experience, the added value of the previous donations by Cosmos Energy in November 2020, that was existing of one Mindray patient monitor for the delivery room, one Mesh-LED 3 Smart Dual Head surgical light for the operation theater, and two wheelchair scale platform. That was donated in November 2020 with a total value of $25,047. We had added a request to Cosmos Energy for 50,000, but they had restrictions due to the oil price and everything monthly in the world. So they had a cutoff of the budget. So we had to add another 25,000 maybe in the next year. At that time, Cosmos handed over their shares to Shell. And that's why we had to end with Cosmos Energy and line up for Shell Suriname. So this request for medical equipment was addressed to Shell through Staatsoli, and this is a donation for other highly needed medical equipment, as you have heard, for our new medical facility, which, as you heard, now in construction, named the Neonatal High Care Unit. In August 2021, Slans Hospital opted for this equipment for the Neonatal High Care Unit, which should be approved by Staatsoli before it could be sponsored by Shell Suriname. And the finally approved list of 25 of August 2021 included the following items: Draeger Isolate Baby Incubator, as you have heard, of with a value of $20,560.80, and a Neopuff resuscitator system for the animation of neonates for $4,318.58. Total amount of $24,879.38. That's the sponsorship.
Shell has a long history in Suriname, and specifically regarding the exploration, Shell re-entered Suriname in 2020 through the acquisition of Cosmos Energy's operatorship and interests in Block 42. So that's in the offshore part of Suriname, in the deep water. And then a year later, in 2021, Shell, in partnership with Chevron, entered into the shallow water, and that was in Block 5. So regarding health and this project, so today at least half of the world is unable to access the treatment that they need in terms of healthcare, and that's according to the World Health Organization. And in too many countries, healthcare is either limited or not adequate for requirements. I think we all know and recognize the importance of tackling the infant mortality rate, but also in helping to give newborns the good start in life that they deserve. And I think that's what really gives rise to this project. In 2020, Slans Hospital approached Cosmos Energy at the time to assist them in upgrading their medium care and high care facilities and neonatal units. They informed of the importance of the number of newborns with life-threatening birth problems, and informed of that rate, which was increasing at a rate which at that time was concerning. This was one of the projects which we as Shell took over from Cosmos Energy at the time of the acquisition. But I think it was a very important project for us, and we recognised the commitment towards supporting healthcare in Suriname, and we agreed that this was an incredibly important project and indeed life-saving. So for that reason, we welcome the opportunity to make a contribution towards the modernisation and upgrade of the neonatal facilities. This donation specifically was at an estimated cost of about $25,000. And in Shell, our social investment and our commitment to is really to help in terms of social economic development, sustainable progress in terms of people, environment, and community. And I think the ensuring the health and the well-being of infants and children are some of the most important investments any country can make. So for that reason, I think we wish to also applaud the Ministry of Public Health and Slans Hospital for their commitment to ensuring child survival.
The government sees potential in health and understands also investment in health. So we are aware and we are convinced that this project, the high care unit, will provide a relief in the care of our newborns. And as you know, we have the media here. The past months, we have seen a very high focus on the health and the care for newborns, and especially challenges in more human resources, where we experience a high intensity of brain drain of highly specialized health workers in our neonatal intensive care unit in the academic hospital. And I think, and the director has mentioned it, that not all people are very happy or sees the idea of the high care unit. We are aware of the critics, but we see this as a relief and also a support to this important unit in the academic hospital, that not all babies or newborns with complications should be presented to the neonatal intensive care unit, being aware of the fact that human resources are a challenge. So the Slans Hospital, traditionally with a high amount of newborns with deliveries, has the capability, the experience, I'm convinced, that the quality of care could be provided here also for a subsequent group of patients. So the impact will be significant. And we know the discussions. We know the discussions about increasing salaries. The question is, if increasing salaries at this moment, to what level should we increase the salaries? Because internationally we see a high demand for healthcare workers. We will not reach that level of Europe and the United States, but we should be somewhere in line with what is acceptable and going on in the region. So I just want to give you an idea of how this has been going on, and especially the Ministry of Health being aware of the financial challenges. The director of Slans Hospital knows that very well. We stimulate and promote public-private initiatives to support where the public sector, where the government is not able to completely fulfill the wishes and the ideas of hospitals in providing better care. So I am really grateful and really thankful, very happy that Shell, as an international company, and also you have mentioned the bond of Suriname and Shell, is aware also and is also willing to support Suriname, especially in health. And I would say, as Minister of Health, to keep supporting the health sector, because health will always be necessary, especially with the future and the near future of the oil and gas investments and businesses going on. So I will not make it too long. I think I have spoken already too long. I am once more, on behalf of the government, on behalf of the cabinet and the Minister of Health. I would like to thank both the Shell and Staatsolie for helping setting up this donation. Also, Slans Hospitaal, there is more work to do. There is more equipment needed. We should seek possibilities into dialogue, into Shell, and seeing what Shell can also mean further in this, I think, very high impact project for our community.